Yeah, Annie?
All right. Online, it looks like we have Carolyn Bean, Cheryl Hartman, Christina War, Alicia Beckholz, Martin Kidston, MCAT, Melissa Fisher. In 206, we have Commissioner Bureau and Slotnick, Andrew Chorney, Carrie Powers, Adrian Beck, Vinnie Pavlich, myself, Annie, Kathy, Ann Hughes, Chris Lounsbury, Emily Briscoe. And then we have a few guests. We have Mark Hayden from Missoula Electric Co-op. And we have Leah Brody.
And Shannon Sproul.
And Susan
Haypatrick. And did I miss?
Good job.
Nope, I think we're good.
Okay, is there any public comment on items not on the agenda? Moving on to the consent agenda. Anything we need to pull out or anything anyone wants to discuss separately?
Good. I would move past the consent agenda.
Second. Any further discussion? All in favor? Aye. Action items. Adrian Beck.
You got it. As Annie mentioned, we have Mark Hayden with Missoula Electric Co-op here with us today. As I put before the commission about 4 weeks ago, we had our recipient of the Building Resilient Infrastructure and Communities Grant. Missoula County is the eligible applicant. We were applying on behalf of Missoula Electric Co-op. And so what you have before you today is the subrecipient agreement for us to pass that money through to Missoula Electric Co-op for their project in the Rock Creek area, which I will let Mr. Hayden describe.
Yeah, good morning. Thanks for considering this. You know, wildfire mitigation, I think, is one of the greatest risks to our cooperative, our community, and the Rock Creek project is high on my list. These power lines cross steep mountainsides. They're very inaccessible. This roughly 3 miles of burial will bring that power line off the mountainside. Incredibly difficult construction, as you might imagine. It's called Rock Creek for a reason. And the roadway is quite narrow. We'll be meeting with the county road department, Missoula County and Granite County, as we try and site this line. But just again, I can answer any questions, but appreciate very much the support of the community or the county to get that power line off the mountainside.
Great, thanks.
Martin, do you have anything?
I do not. I've heard this before. You guys have taken this up, I believe, once before. So thank you for the opportunity.
How much is the grant for?
The grant is 900,000, $1.2 million project. We hope. It will depend upon the difficulty of excavation.
And if it works out, when would the money arrive and when would work commence?
So phase 1 has been approved, and that was an emergency approval because Blackfoot had an issue with a crossing across the stream, and rather than disturb the ground twice, FEMA gave us emergency approval. That's what we're approving here today. Phase 2 would be for the remainder of the project. There may be some restrictions as to times in which we can do our construction because of bull trout and other concerns. But our hope is to have the project done this summer / fall.
The most consequential work was that bore under Rock Creek that we were able to leverage, Blackfoot's project. So that was really good business, and we don't have to get in the water again.
Is there anything else that goes in that board, MEC, or is there another utility or
Blackfoot?
Blackfoot.
Yeah, so Blackfoot needed to cross the stream. So they were asking for emergency.
Just those two. Okay.
Yeah. And so as long as they were boring once, they put conduit in for Blackfoot and Missoula Electric at the same time.
Okay, there's nothing else. Why did I think something else?
Just curious about this grant, the R in there, the resiliency. Is this grant really designed to deal with the impacts of climate change, or does that resiliency stand for something else?
It absolutely does. I mean, BRIC, the Building Resilient Infrastructure and Communities, has lots of priority areas. One is obviously hardening our infrastructure to withstand a changing climate, but also to ensure that that we are making our communities more resilient by making sure that we aren't causing more disasters, right? And so in this case, we're kind of hitting it from two sides, in that we're taking the existing kind of hazard of overhead power lines in an area where it is extremely high for wildfire risk, but also really hard to maintain those lines. And so as you know, whether it's a winter storm or a wind storm or a wildfire event, ensuring that we have that reliable power in that corridor is one of our priorities.
Great.
Those folks that live up Rock Creek don't extended outages, right, in the middle of winter.
Yeah.
Helicopter pulse, that's when we need to repair lines. So.
Yeah.
But to your point, we are looking at BRIC for all kinds of projects in tandem with the city because of its emphasis on climate change and climate impacts.
Was BRIC part of the infrastructure bill?
No.
Was it something
No,
else?
it's a separate allocation.
Missoula Electric has applied for and been awarded a number of grant opportunities through the bipartisan infrastructure law. We've got roughly 40 miles of underground. We're going to bury in the Sealy Swan Valley.
40 miles.
40 miles. We have another wildfire mitigation related project, which is converting all of our hydraulic reclosers, those things that blink your lights before they go out, with electronics that can be controlled from our office, coupled with a weather monitoring system, so we can see these red flag events before they arrive and change settings to reduce fire danger. So yeah, there's lots of funds available out there, and trying to tap them where we can.
Great.
Underground power is a good thing.
Thanks. That's great. All right, I would move that the board approve a sub-recipient agreement.
Enthusiastic second. Any further? Okay, all in favor? Aye. Correspondence? Do we have anything? We got some fentanyl to go with our Narcan. Okay, I guess it's up to.
I'll start. Susan A. Patrick, CEO, United Way of Missoula County. As always, thank you, commissioners and staff, for your service. We all know that drugs are devastating our community, our state, and our country. We are not going to arrest our way out of this problem. And until we as a society focus more attention and provide more resources for prevention, treatment, and support for people in recovery, drug cases are going to continue to choke our hospitals, our court system, and our jails. There is a small bright spot in this bleak picture, and that is that any one of us given access for free to naloxone, most commonly known as Narcan, can save the life of somebody suffering from a drug overdose. And that's why United Way of Missoula County is partnering with these fine folks, our contract employee Shannon Sproul and Missoula Public Health, represented here today by Leah Fix-Brody, to bring 4 Narcan vending machines to Missoula. We wanted you to know about them because you'll see them. They have a very distinct look. And we wanted to ask you to support this best practice public health approach to this really devastating epidemic in our community. And with that, I'll turn it over to Leah and Shannon. I think they have a short presentation, but as always, thank you for your time.
Thanks, Susan.
Thank you, Susan. Good morning, everyone. I'm Shannon Sproul, and Leah's going to try to pull up our presentation. Leah and I have been working together for 3 to 5 years. And as part of our work, we're always looking at prevention pieces. And our latest project is called Dose of Hope. And it is through the United Way, facilitated through the United Way in partnership with the Missoula Drug Safety Coalition. I'll circle back to who that is in a little bit, but United Way, Montana Public Health. And I'm going to let Leah do the first part of our presentation.
Yeah,
Thank you for that.
Okay, so some of you may know me. I work at the health department. I focus on substance use disorder prevention, which includes, what can we do in terms of reducing overdose fatalities in our community? I co-facilitate a group with Shannon called the Missoula Drug Safety Coalition. This group is actually kind of a combination, recently combined group where we had the Missoula Prescription Drug Task Force, as well as the Missoula Substance Use Disorder Coalition Harm Reduction Committee. We combined forces, just felt like, we wanted to make sure that we were not duplicating efforts, but really working together. So we have some really strong partners in our community that are a part of this, that are interested in how can we reduce overdose in our community. So these are some of our partners. The reason we're here today, we've been talking about overdose. We know that overdose is happening in our community. If you read the news, you'll see the fentanyl crisis, opioid crisis. But what is happening in Missoula? And you'll see just in general that we are seeing an increase in drug overdoses in our county. So it's not just happening somewhere else, it's happening here. Overdose, we've seen a gradual increase for all drug overdoses in Missoula County, but specifically, if you look down at the bottom, fentanyl overdose has increased significantly. So fentanyl is basically 100 times more potent than morphine. It's being added to a lot of different street drugs. And many times it is, because it's manufactured in a way that's not, governed by, FDA, then sometimes you might have a really potent batch come into our community and unfortunately many fatal overdoses might happen. So I'm actually working with Adrian on another project around how can we address that in our community. But we're talking specifically about this particular project. Missoula County, we saw a 71% increase in fatal overdoses in just 1 year. So in 2022, we saw 24 overdose deaths. And one strategy, so this is just one strategy and many strategies that we could be doing in our community, is to address overdoses by making the drug naloxone or Narcan commonly available in our community. The Department of Public Health and Human Services has a grant where many people across the state can access a Narcan for free. So a lot of the Narcan that we are getting is specifically we requested from DPHHS, and then it comes into our community. So,
what was that number again? You said so we have a 71% increase, but how many people?
So 24 overdoses in 2022.
24 fatal overdoses.
Correct.
Okay.
All right. So we've been trying to do this work since 2017 here in Montana. Back in 2017, the Montana legislature passed HB 333, which is Help Save Lives from Overdose Act. And part of that is, really making sure that we have naloxone available across all of our communities. One thing that did was make sure that pharmacies could give out Narcan, not for free, but they could sell that Narcan without, it having to have like a prescription, right? Another thing that it did was, the DPHHS was able to start distributing this. And then another thing that it did was it basically made it so that people were protected if they were distributing Narcan, if they were administering Narcan. So that really protects people who are giving out Narcan. So, and then another thing that does it laid in law the Good Samaritan law, which basically says, if somebody is experiencing an overdose, if they call 911, they're not going to get in trouble for, using drugs or having paraphernalia on them. And that both protects the person who is experiencing the overdose as well as the person who is calling.
Is that unique to Montana?
So
Good Samaritan law?
Good Samaritan law. So this particular Good Samaritan law is unique to Montana, right? But we also at the University of Montana, they also created a Good Samaritan law, and I think part of it is just to remind people, hey, you're not going to get in trouble if you call it. So.
But I also would add there are many other, if not most other states that have Good Samaritan laws. It's not, the law itself is not unique to Montana.
I'm just seeming to remember some sort of media story about someone administering care and never mind. Anyways, them getting embroiled but it wasn't in Montana. And so I was just, okay.
Absolutely. Yeah. Great. Yeah.
Good. Thank you.
No. That's
Administer the Narcan.
Yes. Yeah. Again, naloxone is an FDA-approved medication that can reverse an overdose. We brought some in today. I only brought 3. I should have brought more. And so if you would like any, certainly take some. So it's given to a person who's experiencing an opioid overdose. The only thing that it affects is an opioid.
Passing anything around.
Yeah, and this actually just shows how to, it's just basically a nasal spray. If you've ever used Flonase or whatever, you know how to use it. Basically, it blocks the effects of opioids in the brain temporarily and can restore breathing. So really great. And I think just something that everyone should have on hand, just in case. You might not know somebody who might be struggling with an opioid use disorder in your life, somebody, who maybe started using an opioid for after a surgery. Also, I always keep it on me. I live by the Milwaukee Trail, and sometimes, I might see someone, passed out, and I'm, I've never had that person actually have an overdose, but just checking on them, making sure they're okay. And so you never know, who you might run into. So. I already talked about the Good Samaritan law a little bit, but this is some of the language from Montana Code Annotated, helping to protect people. Now, not everybody knows about this, nor does everyone trust that this would happen, right? So we have a wonderful partner in town who is working on doing kind of like a know your rights kind of publication on the Good Samaritan law and what your rights are. So, yeah. And with that.
All right, with that, I'm up. And so we did talk about at the beginning that the Missoula Drug Safety Coalition is a combination. And when we started this project, it's because we had heard there was a news story that came out last May about Helena putting in 2 Narcan vending machines. And we contacted them and asked them for information and tell us about your program. And honestly, I think Susan might have said something like, hey, Helena has them. Why don't we? And the stars aligned, and a funder came forward and said, if you guys are interested in this project, we'll fund the purchase of the machines. So it really happened rather quickly that it all sort of, the stars aligned and it all came together. So we started doing some research, both locally and nationally, about Narcan vending machines, what they do, how much they cost, how do they work, et cetera, and have moved forward from there. One of the things that we did at the beginning was to, there is something, I'm not sure how familiar you are with it, called ODMAP, overdose mapping. And you can take that mapping and zone in very, very closely. And we were able to look at Missoula County and the city of Missoula and look to see where overdoses, both fatal and non-fatal, were occurring. And there were really 5 main areas. Number 1 was downtown, right here along Ryman. Right here. And one was on Ryman, one was in the area of the Poverello, not necessarily the Poverello, because they actually have Narcan and they hand it out. They probably do a lot of rescues, but I would say like within a 6 block area of the Poverello was another area. Another area was sort of the mid Reserve Street, sort of Salvation Army, Western Montana Mental Health Food Bank, that area right in there. One area, and again, blocks, several blocks. And then the fourth area was sort of North Reserve in the Costco REI sort of area. And then one sort of further out, bigger area was basically the intersection of Reserve and Brooks. So some stuff happening there. So we took our first three priorities, which were the Poverello, downtown, and that Russell Street corridor, and said, let's see if we can find partners. One of the first partners to step forward was the Mountain Line Bus Transfer Center. And so you will see these are our four partners, and we base that again on incidents. So Mountain Line will be receiving an outdoor vending machine that will be next to the building, next to the little transfer center building. Yep, right downtown. And so we're really super excited about that because as we've done research across the US about who's doing Narcan, it became very clear that having 24/7 access was really critical. When people need it, when people want it, it's important. And it's important to offer it low barrier so that we're not punching in lots of numbers. They will be regular vending machines, but they're free. They will be free. And so they'll punch in their A7 or whatever, but they're not paying any money for it. Pardon me. Second partner, the Poverello Center, of course, stepped forward and said, absolutely. We've had some discussions about, they feel it might be more useful at the Johnson Street shelter at this time. So I think that's maybe where it's going to be placed. And then the food bank was also very interested in having it at their place, and then Hope Rescue Mission will have a fourth machine. The machines at Poverello and the food bank will be indoor, sort of narrower machines. And then the Poverello, actually, if you remember the old newspaper boxes that you put a quarter in and open up the door, that's their version. So it's not a traditional vending machine, but it will be open for access that way as well. Thank you. So obviously, sorry.
I'm like suddenly thinking of the temperatures, heat, freezing, expiration dates.
Mm-hmm.
How many go into a machine? Like who manages them? Well,
so that's why I'm contracted with United Way, is that I'll be doing the maintenance of them and tracking them. The outdoor machine has a heating and cooling system to keep it the appropriate temperature, and the other ones will be indoors. So heat cooling.
How long? Yeah, what is it? I can't read this.
It's 3 years, so I think that's probably expiring in 2026.
Okay.
And then it shouldn't get above 104 degrees Fahrenheit, and at below 5 degrees, it will freeze. So you just need to warm it up, and that takes 15 minutes, which is not great in emergency situations.
Thanks.
Yeah.
But in most cases, people are not going to be running to a vending machine to get someone's overdosing, I need to run to a machine. It's really important to get naloxone distributed so that people are carrying it and they have it when something happens, in which case the cold is likely not a problem unless you're carrying it in your car and it's winter time.
Are our law enforcement folks and first responders carrying Narcan now?
They do. Yep. So, yes, and they'll be getting this information as well.
Mobile support team as well.
So what will the vending machines have inside them? No cost access to naloxone, whatever is provided for us currently by the state for free, which is the name brand Narcan right now. Fentanyl strips, which will
this is amazing.
What are fentanyl strips?
Then you can find out if whatever you're playing with is contaminated.
Wow.
That is yes, huge.
So you can find out
wow.
if there's fentanyl in.
Yeah. So it's a little test kit that you can take if someone is using drugs, you can put it in there. You can, just like a litmus test or whatever, right? You sort of wait, you stir it up, you take the test, and it will tell you if there's fentanyl. So it's to me, we're not, the goal is to keep people from overdosing, right? Not necessarily to keep people from using drugs if that's what their choice is. And so this is more of a harm reduction / prevention model. So if we can prevent people from unexpectedly taking, is that the word?
Accidentally,
you know, they don't, a lot of times people don't know that there's fentanyl in the stuff that they're taking. Right. A lot of people don't take fentanyl on purpose. It's a very, very teeny amount, you know, like fingertip, right, is like the amount that can cause a death.
What are the drugs that people are using that fentanyl is in that they wouldn't have expected it to be in?
Everything. Everything that's not over the counter, right? I mean, obviously, if you get something from a pharmacy, you can be pretty assured that it's clean. But if you're getting it from a friend or black market or, you know, whatever, it could be in anything. It's really taken hold.
How it was explained to me was that playing with whatever drug that you're wanting to engage with, then the fentanyl will help make those effects last a little longer if you do things correctly. But obviously it's not regulated, so things aren't done correctly. And then you get a bad batch where there's, maybe you're purchasing all, I mean, it's just like a little corner and it's all fentanyl, or it's an increased amount of fentanyl in a section of the same batch. And so then you have like weird clusters of overdoses.
And fentanyl, and I think synthetic, so it's easier to make as opposed to like cocaine, which has to be grown.
I sort of think about it as when you make a batch of chocolate chip cookies, sometimes you get chocolate chip cookies that have just a couple of chocolate chips. Sometimes you get chocolate chip cookies that have like 8 chocolate chips. You got the good cluster. But when people are mixing fentanyls, that can happen, right? Is that it doesn't get mixed completely. So the fentanyl strips are being provided by the University of Montana's Students for Sensible Drug Policy program. And they're the ones that Leah mentioned are working on a sort of an FAQ about fentanyl strips, and we're excited to have that. We will also have sort of some little plastic bag containers that will have some information cards with resources. And so that, and those will be obviously for free. And then actually it just came up in a meeting last week that one of our partners who works at the Poverello and who is a nurse who works with a lot of cases like this really suggested that we look at mouth barriers as well. So the rubber barriers, rubber masks that you put over if you're resuscitating, because the one thing I do want to note is that for as much as this is such an important piece to get out there, not all overdoses are caused by an opioid. You could have other types of drugs that cause an opioid, or excuse me, cause an overdose, and Narcan will not help in those cases. It only affects opioid receptors. So, huge piece of it is resuscitation breaths when you're rescuing someone.
And when will face shields be added, or?
Well, they're not in place yet, so we're hoping to add those. So 24/7 access, I mentioned no barrier. There is a QR code on the outside that will lead to a United Way based website that will have, treatment resources, prevention resources. Where can you go to get help? There's also an 800 number, the same funder, who is the Independent Emergency Room Physicians Trust. They are also sponsoring a project putting peer support in the emergency rooms for folks that end up there with either an opioid disorder or an opioid overdose, to have support and treatment recovery support as they leave. So there will be an 800 number to those folks. Beautiful Minds Recovery is who will be providing those services. So I just mentioned funding from the Independent Emergency Physicians Trust. They are a trust that formed, they're based on the East Coast, but one of their trust members happens to live here in Missoula, which is how the connection got made. But they're one of the many trusts that have been formed by the big opioid settlement funds. So, and it is basically, rooted in how do these things affect emergency room doctors? So obviously, if we can prevent deaths, then we can help emergency room doctors do their work. We are hoping, I need an update from our distributor, but we are hoping the machines will be arriving sometime in the first 2 weeks of April. That's an estimate right now, but it should be soon. And then the maintenance will be provided by United Way and their partners, me at the moment, for the maintenance and the restock of items. So we'll be tracking it to see how much is being used, what items are being used, you know, all that sort of stuff, getting feedback.
What were the 4 sites again?
The Mountain Line Bus Transfer Center, the Pavarello, which is, we're looking at either Johnson Street or the actual Pavarello. Pardon me, Food Bank and Hope Rescue Mission Drop-In Center.
Thanks.
Yeah. So some of the questions, I'd love to hear questions from you guys, but just up front, sometimes people feel like, why are we doing these things? Why can't we just stop people doing drugs? And so these would be 3 examples of what it is we're doing.
Why can't we, Shannon?
we use seat belts to prevent injury and death, right? We don't keep people from driving. We use seat belts to prevent the injury and death. We put legal limits on blood alcohol content so that people will not die from alcoholism or I want to say overdose. That's not the word I'm looking for, but again, to prevent injury and death. And again, the same thing with encouraging ride homes when we're talking about alcohol and driving. So those are just some similar ideas of why we're encouraging harm reduction. There's a couple of great articles that came out, one from the National Association of Counties about a year ago, and then just recently, just last month, an article on from CNN. And so that sort of concludes our presentation. Are there questions from folks on the call or from the room?
So in Oklahoma, so imagine Oklahoma City is doing this. Are other major cities doing this as well?
Oh yeah, there are cities across the U.S., lots of larger cities, Kentucky, South Carolina, New York, California, Michigan, huge response in Michigan. There's a harm reduction organization called Harm Reduction Michigan that has put vending machines, the newspaper box kind, that's all they use. But they have them in something like 37 counties. So they've put them all over.
How much is this to purchase over the counter?
Depending on what insurance you have, $40 to $50. If you have Medicaid, it's more like $4 or $5.
But if you just want, I mean, okay, so
yeah,
pretty wonderful act of philanthropy that someone has covered these costs.
Well, the state, Leah mentioned earlier, the state of Montana gets a grant called the State Opioid Response Grant, and that helps provide.
What's the emergency physicians? What is their group buying?
They bought the machines themselves.
Oh, they bought the machines. Okay.
And they're providing funding for the maintenance of it.
Awesome. Thanks.
Yeah. Any questions from the back? Any questions from online?
Yeah, Martin just raised his hand.
Martin, yeah.
Hey, yeah, this is pretty interesting. One, just to clarify, 1 bottle represents 1 dose, correct? Are there any special skills required to administer it? And 3, how long does it generally take for an overdose person to respond to it?
Yeah, so if anyone wants a training, both Shannon and I are trainers. And it's really quite simple. I mean, I think, so each box contains 2 4-milligram doses. And so what you do is you just use it like a nasal spray. You should wait 3 minutes because it takes about 3 minutes for it to work. If that person does not respond in that time, you can give another dose. One of the nice things is the only thing that it affects is opioids. So if I were to give this to myself right now, I would just have a wet nose. So I would not worry about it. Just, you know, if that person appears to maybe having an opioid related overdose, main things to look for are your fingernails and lips, what might turn blue. Okay. So, because they're lacking in oxygen. they're not, likely not breathing. So, and then it can wear off. It might wear off anywhere between 30 to 90 minutes. And that's why it's so important that 911 comes, because they may go back into an overdose. That helpful?
That's perfect. Thank you.
But if you want a training, let us know.
So the protocol, Martin, would be to check the person, call 911, give them a dose, 911 will be on their way, and to do rescue breathing. So those are, and I mentioned earlier, rescue breathing is really a huge part of it, because what if it's not an opioid overdose? What if it's a different kind of overdose?
Yeah, some what we're seeing with some street drugs is like they'll have fentanyl as well as xylazine, which is a horse tranquilizer, which is supposed to extend your high. And so if that person, if they respond to the Narcan, but there's still xylazine in that system, they may not recover. So giving them those breaths is really important.
If they don't respond to the first one, do you hit the same nostril?
So you do the full dose with this the first time, and then because there are 2 in there, you can give the second dose.
But the same nostril? Or
it doesn't really matter, but you could do the other nostril if you want.
That thus concludeth our presentation. No, Martin, sorry, did you still have your hand up? Okay.
Sorry.
Thank you for having us.
No worries.
Thanks for coming.
Thank you so much.
Yeah, you bet.
Good job. Good work.
Yeah.
By April, this will be in place.